Very good morning, everyone. Thanks for joining in here on this session, which is very specifically and thoughtfully captioned as how stress and neck pain are interrelated. So let's explore about this stress and neck pain. So basically, the way we would have the session today is maybe for about 30 minutes, close to 40 minutes. I'll also share my views on this particular subject of stress and neck pain. And following that, we will also take up some questions which are on Zoom, and we're also live on YouTube. People can keep joining in, but the session continues. So once again, thanks all of you for joining in. And let's, basically understand and explore and start with what we really talk and pursue about stress, which is so much spoken these days. So I'm sure you'll agree with me when I say that it is one of the happening topics or happening words, but people really don't want to talk about it because they're also bored about it. So either way is the problem. So when we understand, more about stress and how basically it kind of impacts our life, it just doesn't impact us. And, when we say that it's majorly impacting, but it is impacting. So it's a phase where we probably know that it is a term stress, and it is also tension and whatever else happens. But beyond that, there is a lot which we should understand. So this is something I think which all of you will also be experiencing. And you say that, oh, why people not understanding what's happening to me? Is my future like this? Oh God, what's happening to me? What's happening to my family and such things now, right? So these are some factors of stress, but we also need stress in terms of the driving force, which is also very, very important. So stress can be therefore negative or positive. A student, just now we have seen that 10 standard results have come in, 12 standard results have come in. So obviously in this situation, how are the students being driven? They're being driven by this whole force of, having that intent to do something better in their life. And probably these scores are very important. Said and done, yes, there is a different way or perspective each parent, each student has just towards marks or scores. So I'm not just highlighting that aspect of marks, but I'm trying to say that there is some amount of force which is driving you to do better. And that is otherwise the positive stress we are talking about. So when we talk about, therefore, the different types of stress, let's start and understand about the positive type of stress, which is called eustress. Somebody here is asking a lady, will you marry me? So she's so elated, she's so happy, but this person has made some ground preparation to say this to somebody. So it is this whole factor of, falling in love, being in love, also see that you have scored so well in the exams. You have probably bought your first car, or maybe, now car is so common, so maybe an Audi. So it's all like this. It's all about what we understand and how we're able to drive ourselves positively. So don't always think that stress is negative. So stress definitely has a lot more into what we generally understand, because we always say, oh, I'm so stressed. You want to pull your hair and feel like banging on the wall sometimes, isn't it? So it's more than that. But without this driving force, we also cannot probably live and thrive. We talk about people in business who need this driving force, and without that push, the pull, where you probably see a good balance sheet or a good P&L is also not possible. So there is always this positive thrill which is attached to stress. The other side of the coin, what is it? It is distress. So as you can see, I just told you feel like pulling your head, you feel like doing something. I'm so much at distress that I really don't know what to do. One is that I'm feeling lost. Somebody is no more. So I've lost my loved one. Okay. And during COVID, I think we've had a lot of these issues. And especially small businesses, medium businesses have faced a lot of problem related to finances, which have definitely contributed to larger portion of distress, right? And obviously, people have had history of strained relationships, which definitely is not something which people would like to undergo. So these are some factors, including falling sick, like I said, COVID, right? So that itself is a big stress. Now, the moment somebody saw a positive result on the blood investigation, they're all scared, right? But that gives them so much of stress. What happens then? There is an adrenaline rush, which happens. You start feeling numb. Your face starts feeling probably red, hot, and you're not able to control your emotions. You feel like crying. So, and at work, other side, let's take the commonest example of maybe software engineers who are pushed, not just in 8-hour work, which is on paper, who are pushed, to much beyond all this. So what's happening there? It's very clear. Okay. So they're pushed to work for maybe 10 hours or maybe 12 hours. You take late night calls, so many things happening. So there's a lot of work pressure, okay, which is beyond a certain line, which we talk about, beyond the line which they can probably take. So this stress is something which can also lead to damage onto your body. That means your system also slowly starts collapsing, because there is a limit which everybody can probably tolerate, and we are little over the limit we can still tolerate, which is a little over that also. Then there is a definite issue where people are able to withstand or not withstand. It is personality dependent, but there is always a phase where it is going to break down. Therefore, managing distress is one of the primary requirements. First of all, understanding that there is distress which is setting in is also a very, very important issue which needs to be addressed. Likewise, you have hyper stress. Now, what is hyper? We talk about, oh, this guy is hyper, he's always hyper, he's hyperactive, he is hyper thinking, okay, all the time thinking. Hyper is something beyond. We have problems in life, no doubt, okay, whether it is a problem with a working lady who has to balance home, work, and at home there are children, there is husband, there are so many things, and at work there are colleagues, and if you are an employer, then there are many more things to solve. So in such a situation, obviously there are a lot of thoughts which are going on in a person's brain, and you will have to process the thoughts. Now I'm at home and think about, okay, what can I do at home? And the moment I go to the office or workplace, I should be clear that I am not going to think back at home, right? And it's not easy to do, but I think it's all about training ourselves. And as soon as we start understanding how to train ourselves, life becomes much more easier. And I can tell this also confidently, because I am also able to do that. And I am also in this first category, which you can see. But many times we are also not able to do. So that ifs and buts are always there in everybody's life. And I think we have to accept it. And there is that exception and understanding will play a very crucial role in seeing that you're able to handle that. And what else, can happen? So in the hyper stress situation, your mind is always thinking. What is this? So yoga, talks about samatvam yoga uchyate. So that is one of the definitions. Samatva means balance. So balance also means that there is balance of thoughts. You know how much to take, that is how much to receive, and how much to give back. Your mind is always thinking, you wake up in the morning, oh, I have to do this, I have to do that, go to office, do this, do that, project submission, something else, come back. So not only this, you have so many other things to think. Okay. So if your mind is not able to rest, then it is also not happy. So obviously it will show its tantrum on you. Your physical body will experience the tantrum thrown by your brain because it is not able to take the load, right? So that's how it works. And nowadays, especially in urban population, hyperstress is a very, very common phenomena, and we will have to understand very clearly as to how this can lead to many problems. So coming to that, because primarily we are understanding this to say what happens, when people have stress and how it manifests to problems such as neck pain, because finally we are coming there. So what happens in hypostress? I think the image says it all. Oh, I'm so happy. I'm just sitting there. I get up in the morning, slowly do something, brush my teeth, go there, sit on the sofa, in the living room, just watch some TV, eat something. I'm so relaxed, so that is not going to work as well because you don't have a challenge in life. Whether you're a farmer, living in a village, should also have this. Probably this may not be a great thing to do if people are fed in the villages, right? So an unchallenging situation is also not very good. And therefore it reduces your performing skills, and your thoughts. Your brain is not sharp as it can be otherwise. So either way, keeping that, crossing the upper limit and going down the lower limit, both are not very, very motivating factors. Especially hypostress will demotivate you, will make you restless. It can completely take you off your skills. So people have also to be very, very conscious about the same. Now we've understood 4 types of stress: eustress, distress, hyperstress, and hypostress. Now what's happening? Why did I really just give you these 4 pointers? Because they can lead to different problems at the body, which is at physical level, mental level, and behavioral level. Now, what all happens at the physical level? Pains, first thing, okay? Many people are not able to understand that this is one of the leading causes for pains, especially stiffness in the shoulder, neck not feeling great. We want to do this all the time because there's something, impeding, blocking the movement, etc. And a bit of heavy-headedness, lightheadedness, feeling a bit of pain at the neck area. These are some things which can lead, which can probably come in when you have excessive stress, which can be any of those. But yes, the positive stress is not what is going to lead to these problems. So let's be clear there. And is it just pain and at physical level, which is muscle related mostly? No, it's definitely gut issue. So very clearly understand that hyperacidity has become one of the major challenges. I see so many patients who have hyperacidity these days, and they have been taking medication for 6 months, 8 months, 10 months. Normal, go to a gastroenterologist, take the medicine, keep going. You have a problem, again, take a 3-month course. So that's not going to lead you anyway, because you have to understand what is basically going wrong. When stress increases, your nervous system is also, like this, pumping everything too much. And when it pumps too much, it also pumps too much of acid in your stomach. So your enzyme secretions are high, and that can lead to hyperacidity. So there's simple, analogy which you should understand to say how these things are very much interrelated and very, very helpful also to you if you're facing any of these. And it is also increase in blood pressure, which is very common nowadays and being seen in younger population, early 30s itself. And then you have a lot of mental issues, which is anxiety to fatigue, lack of focus. I have some panicky feeling. I don't know what to do. And I'm kind of not able to really, control myself. All this can happen. And by just this, it is much more anger tantrums, impatience, shouting, irritability. All these are behavioral changes which are also seen. And you can see where this whole information comes from. It comes from the American Institute of Stress, and it has also been published in Harvard Business Review. That means to say they have a large report of different continents, especially in this particular study. So this information is just substantiating what you're going to talk about, which is neck pain. So stress is one of the major triggers for an existing problem. Stress is also one of the cause. It depends on what is the problem actually. So if the neck pain is due to a bone related issue like spondylosis or an injury or a fracture, then stress is not the cause, but stress can increase the existing pain. If the existing pain is say 6, out of 0 to 10, where 0 is zero pain and 10 is excruciating or very, very, very bad pain, then from 6, the pain due to stress can go up to even 8 or even up to 10. The moment you start working on stress, then it starts coming down. So this is something which you definitely need to understand, right? And there are many problems related to the origin of neck pain. But the most commonest problems have been mentioned here. So what is myofascial pain? It's the muscle which is also involved in pain, which happens very commonly, though there is no bone related issue. So we are sitting all the time like this, or not moving too much, watching the laptop, doing a lot of work, whether you're a doctor, engineer, and you're into accounts, finance, anything, then you land up, students, all of them land up using the laptop or a desktop, and these are definitely going to contribute to pain if you don't do anything to not to get it, right? So that's what we need to understand. What do you do not to get the problem? Very, very important question. So before that, what are the other reasons why you can get neck pain, which is mostly very, very common? Okay, I give you a large picture. Now let's just focus on very simple things. Poor posture, the way you sit, the way you work, which can lead to muscle spasm, muscle stiffness, and then your exercise is not adequate. So obviously blood circulation to this particular area is less. Once the blood circulation reduces, then you start feeling the pain, okay? And the moment you start moving your arms, exercising, giving the muscle the strength it needs, circulation is enhanced and you see reduction of pain. Of course, in many cases, we need to do a lot of other things as well. So other contributing factors can be sleep issues, mattress issue, very, very common. Oh, my bed is not good. Whenever I sleep and get up, I get up with a stiffness in my neck and upper back. Some of the very common issues, driving and sitting. So the last 4, sleep, mattress, driving, and sitting, are the very, very common issues for, I think, many people. Okay, so this is where when we work on different aspects, we can see a lot of help for ourselves. So what is that we can actually do to manage the neck pain? Okay, so stress, what exactly happens in the body? I told you about how the nervous system works, and it releases more acid. Similarly, it also releases certain chemicals which can bring in the onset of pain and also increase the existing pain. But in many cases, it also causes pain. So there are different factors in which neck, which is one of the very, very sensitive areas. So don't we say, you're a pain in my neck? Not literally that I'm having a pain, but this particular person I'm talking about is a pain in my neck. Because if you have a neck pain, I think it is going to really, really hamper your day-to-day activities. Because if you sit like this, after 5 minutes, you have a pain. If you do a little more, then your maybe arm starts paining if you have spondylosis. And if you are not attending to it, you get a very nagging headache. Okay, so neck position, neck extension, looking down, all these are postural things which we are also going to look at as to how to manage. But in Ayurveda, when we deal with this, and in, say, in Vivekananda Health, our approach is very integrative in its nature. So we combine the Ayurveda principles with yoga and acupuncture. So when we look at stress and neck pain, the best way to see that your nervous system is, under check, and that it is also helping you relieve your neck pain is the inclusion of yoga, because the mind has also to be under good control to see that your problem is under check once again. Okay, so Ayurveda medicines again work on bringing down the inflammation, therefore improving the circulation, and also enabling to see that your mind is better at balance, is more relaxed. Okay, therefore you start feeling reduction in stress. Such are the therapies of Ayurveda which can help in achieving the same. Like you can see an oil pooling therapy on the neck, which is very simple, looks very simple. Yes, doing that is not very simple. You have to have skillful therapists or Ayurveda nursing staff who take care of this. And it reduces inflammation because the oil used is a medicated oil, and it definitely brings down the spondylosis when we do it for a course of time. One day therapy is never useful, and it works on the basis that there is fat element even in the spine. And when you rejuvenate this fat and start strengthening the spine and also especially the muscles around the spine, it helps the particular condition. We also have fomentation therapies. Like you can see a bundle here. It has medicated leaves in it, powders in it, mixed in oil, and it is fomented on the affected part. So fomentation again enhances circulation, makes the muscles relaxed, and you also feel very, very relaxed after a course of therapy. There are different types of fermentation, of course, where we use rice paste, which is cooked in medicated herbs. Oil is applied and then it is fermented. Now, when it comes to yoga, soon after an Ayurveda therapy is over, say your pain reduces, but how do you ensure that it continues? When I say it continues, reduction of pain continues, and then you are not at stake again. So a lot of joint loosening, muscle stretching practices are very, very important here. And when we do that very regularly, it is going to be very helpful. So now those of you who are here who are watching, you can just do it yourself as we are talking. Let's just do it a couple of times, and then we'll discuss how all of us have felt. But you're not just going to move your neck now. You have to breathe in slowly and breathe out slowly. Okay, now again you breathe in slowly, stretch well, see how your neck region stretches, and breathe out slowly. So let's do it, one more time. You close your eyes now, breathe in slowly, stretch well, breathe out slowly, stretch well, bend down, try to take your chin closer to the chest so that the neck is again extended. So this is a very important process. Flexion, and this is extension, this is flexion. That means there is this movement and this is extension. So this helps in, this is how the spine also is able to be toned, and definitely the muscles. Likewise, when you do this stretch, right, this sideward stretch, and then you can also do this sideward movement of your neck. So these are some of the day-to-day practices. Say someday you're not able to do your exercise, but you have a stiff neck or you're prone. definitely don't miss these practices. And you can very easily do this shoulder cuff rotation, 5 times. Again, breathe in and breathe out. Breathe in and breathe out. So do it 5 times. Forward, breathe in and breathe out. Breathe in and breathe out. So these 5 practices, up and down movement with breathing, stretching with breathing. So breathe in and stretch, breathe out, breathe in and stretch, breathe out. Say about 5 times. Then sideward movement, breathe in, breathe out to your right, breathe in slowly to the center, breathe out to the left. 5 times of this. Then you have the shoulder cuff rotation, which is upward, again with breathing, forward, again with breathing. Okay, never do it like this and this. This will actually not help you much. It can also increase the stiffness of the muscle. So a gentle rotation gives a very nice stretch to your muscle, which is very, very important. And when you do a stretch, right, the muscle fiber will expand. And then when you go closer, it will contract. So this expansion and contraction of the muscle is very important for the muscle to relax after that. So do like this, then it will not relax well. And what are you trying to do? You want to relax this because you want to relax your neck muscle. And when you are doing it with breathing, it also helps you calm down. So that's how you're going to control your stress. You're going to control the muscle tension and also bring better results to yourself when you have neck pain. So one more practice I will add. So when you're on the desk, whether you're a student, a doctor, homemaker, whoever you are, you can definitely do these practices regularly with breathing. And when you're sitting on a chair like this, just breathe in, hold onto the chair where you're sitting and slowly start bending forward, which is also good for your neck and back. It will stretch your shoulder to the arm very well. Bend forward as much as you can and ensure that you try to touch your face, to the tip of the table. So, like this. So you can just go down and then go up again. So this is very important. And these simple practices can actually help you again. And you can also do this simple twisting, hold the chair, just twist backward, come back, hold the chair again, just go back, twist, hold. Okay, so this is going to be very important too. So these practices can be done twice a day. So just to repeat, up and down movement, sideward movement, side stretching, shoulder cuff, and then you have the forward bending on your table, holding your arm to the chair. So you can just check this again. So you're going to do this and slowly move up. Okay, so your arm is very well extended because of the chair, and then do the twisting. So these 5 will play a very great role. And those of you who have more stiffness, this stretch is very, very good. So this is called Gomukhasana. Your arm has to be very close to the ear, because in a module of yoga, we don't restrict by teaching only what I just told, but these are just one group of practices which at least when you do, you can definitely see some change in the way your neck feels. So just hold like this, okay? So your palms have to be interlocked. One arm here below and the other arm up. So hold it and ensure that it is stretched well. So your back is straight, you look straight, arm is up. It's very close to the ear as you can see. And then again, the other side, hold. So you can just do this sitting on your table, right? So you hold, you just don't hold your breath, close your eyes and just do your deep breathing, maybe 5 to 10 times. Hold it until then. Suppose you can't interlock your palms, don't really worry about it. You can just keep it on the back, wherever. Some people can't reach, so they will hold it like this. This will not give you the extension. So try to improvise. So nothing might happen just on day one. So improvisation will be very useful for you going forward. Okay. So just moving ahead, we just spoke about breathing practices, that too mostly for desk job individuals. But you should also include a module which has a lot of these things, and that is where we train patients with yoga therapy. Our doctors train them individually, not in a group, and this makes a lot of difference. Pranayama is one essential component of the yoga practice, especially Bhramari pranayama is very good when you manage your neck. So when you do Bhramari, you just have to close your ear, and when you do the humming sound, you can feel how that hum is actually, that sensation, the vibration, the resonance is improving the circulation in the throat and neck region. But the major reason why you have to do pranayama is not for circulation, but to reduce your stress. Bhramari is one of the best pranayama techniques because it is resonance based. It can really, really relax you. And especially with people, when you have neck pain, you cannot do practices like Bhastrika or fast movement practices. So Bhramari and Nadi Shuddhi, which is the alternate nostril breathing, Anulom Vilom, which is very well known, are two important pranayama practices. If you say I don't have time, at least do these 6 practices I told you with 5 rounds of Bhramari and Nadi Shuddhi pranayama. And of course, chanting is a great method. You can always use it to relax yourself. So the important feature here is to understand how these practices are going to be very, very useful, and why we cannot take it easily and say, I don't have time. See, yesterday also I had a couple in the clinic, so I can very well relate to what I'm talking today. The person is diabetic. The lady has got some knee pain, and she's got pains all over her body, especially joints, neck, back. And the gentleman, her husband, has a diabetic. He also has frozen shoulder. He's been a diabetic for over 15 years now, and he already had come to me with right frozen shoulder. Now he has it on the left, but that was 5 years ago, and he was completely well after what we did. But if he had followed the lifestyle, he did yoga with us, but he has not followed much. And if care was taken, even minimal care would have been taken, probably the recurrence into the other shoulder could have been avoided. Because even in a problem like frozen shoulder, the shoulder pain, the neck pain is very common because this area becomes stiff. The moment this becomes stiff, the stiffness can, get onto your neck as well. So many such reasons why a person might face, the shoulder pain, neck pain. Yes, this is one of the foremost thing which you have to do. We spoke about what kind of therapies can help you, what kind of interventions can help. But what you also have to change is your lifestyle, which includes diet, the way you look at something, the way you sit, posture corrections, the way you sleep, and the way you take your laptop bag or your school bag is very important. The moment you lean forward, the moment you crunch yourself, then there is a scope of pain. Keep your spine erect. That's why they say sit erect, do your breathing, do your chanting. This is the first instruction any yoga teacher would give you. But if you go to the gym, will they tell you stand erect? No. Will they tell you about breathing? They will not tell you. So the way the gym exercises work and the way yoga works is going to be very different. I'm not saying here that don't go to the gym. Definitely go to the gym, work on your muscles, but you should not overdo, because people also come back with problems injuring themselves, whether the knee, neck, or back. So you should know what you are doing. Don't overdo, because you don't need to build your muscles and probably take it up as a profession. You need to build your muscles to keep your spine health good, which as you do yoga also it happens. But if you want to do active physical exercise, then you have to intersperse gym and yoga practices. Diet, of course, is a very, very important part of the same. And here in the diet, you say you avoid all processed food, hybridized vegetables, take that food which is more nutritious. Include food such as buttermilk, maybe curd to an extent, and also include vitamin B12 and D3 rich food, whether it's rice and leafy vegetables and lot of green vegetables, which are going to be very, very useful, right? Reduce carbs in the night, keep a tab on your weight, and that will be very useful. Use the dry fruits such as almonds and walnuts. They're very good. So you can just soak 2 almonds or 3 almonds in the night and 2 walnuts. Eat them in the morning. First thing in the morning should be take a glass of warm water. Eat these, soaked nuts. You don't have to take a bunch full of nuts. That may not be anything which you do overboard is definitely not going to be very useful. Okay, so they say Ati yoga or ayoga, as per Ayurveda, Ati is extensive, extreme. Ayoga is doing nothing. So you cannot be anywhere there. You have to be in the mid path, which is going to be very, very useful. So overall, as stress is one of the primary causes for increasing pain and can be also a cause for inducing pain, you should know how to manage stress and understand how stress is causing the pain. And all these simple tips which I gave you ideally will help you if you can inculcate them in your day-to-day practice, bring in more discipline to yourself, and bring in more self-regulation, because self-regulation means self-discipline. Nobody can do a change for you unless you want the change for yourself, because that's, I think, the universal rule. Because a doctor can tell you, a yoga therapist or a yoga doctor would make you do yoga, and an Ayurveda nursing staff will help you to his or her best. But who is the person who is going to do it? It is you. You are the person who is getting it done, and you should be the person who is driving yourself to good health. And that's where you can really feel the difference and you can get free from pain. And that free from pain is what is described in Bhagavad Gita also as dukkha nivritti. Dukkha means not necessarily feeling sad all the time. Another connotation, meaning to dukkha is pain, disease, right? So dukkha nivritti, that means you are getting off dukkha, which is very, very, very essential. And it's important that we individuals have to live the best life when we have been given this chance to be here on earth and do our best for ourselves and also contribute to the growth of ourselves and the individuals around us. And this will ideally play a big role. Yeah, so that's all I had to share from my end. And if any of you here have questions, I will be more than happy to answer your question. So you have an option to unmute yourself. You can unmute and also ask your questions. And we also had some questions which were asked when people filled out the Google forms. So we will also take them up. So I hope you had some good inputs during this session. And if you have something to share on the session, or if you look forward to something else, also please feel free to ask and also interact.
Good afternoon, madam.
Yeah, good afternoon.
I'm Dr. Vignesam here. Very nice talk, madam. Very much relevant to what I wanted to that way. Thank you very much.
Thank you.
Just for a small problem, I don't have any other major issues. I had a problem for quite some time, more than 6 or 8 months. The only sleeping time I get up, when I get up, during sleeping, I get a little neck pain. Okay. That goes out when I go for walk and morning, all things I don't see. I mean, it subsidies slowly comes down. Again, while sleeping time only, the neck pain is followed by this palms getting nervous. I mean, numbness also I am feeling. This is the what happening. Palm, I mean, you can see me, I mean, my palm. Okay, video also not coming. Okay, my palms get this numbness. That sometimes it may go to arms also. My sleep is getting disturbed, but it is a random in nature, not daily.
Right.
But I want to fully get out of this. I do morning walks and I do little yoga and all the things. Most of the things I am taking care. I am not a diabetic. I am not a hypertension. These are problems I don't have. Recently, this new issue has come. It is making me, sometimes it is upset. Why should I get these all? Why can't it be? I am right now 69 years old, madam.
Okay, right.
Any good advice can you give me to solve the problem?
Yes. See, basically, if you can do certain exercises, like I just showed a couple of them before sleeping, and also use some Ayurvedic oil to apply, on the neck and shoulder area, it will help you, because probably your muscles are getting stiff. When you sleep, what happens? You don't have movement, right? You're just sleeping in one position, or maybe whatever position you take. But because of that non-movement, which happens mostly during sleep, your muscles become stiff and slowly you start feeling numb. The moment stiffness happens, circulation reduces, and that is the reason for the numbness. So just do those typical movement up and down, this stretch, and then this movement, this shoulder movement back and forth. You can also add this shoulder movement, extend your arm, do this upward stretching, just three times slowly, and apply some oil, which is an Ayurveda oil. You can use oils such as Narayana Taila or, Kshira Bala Taila. Apply it and
Narayana
Taila or Kshira Bala Taila. Apply it. It's very safe, and every day before a bath, you can apply that oil all over your neck, shoulder, and arm. Leave it for like 20 minutes and have a shower also. You do this regularly for about 15 days and then see the change. And you can always get back to us if you need any more help. But because if they're very simple, just with what I said, it would go away.
Okay. Is it due to neck pain, this numbness is coming?
Yes. It is because of that movement and leading to neck stiffness, which because of which it's coming.
Only palm only starts.
Yes, it can come like that.
To arm. It goes to arm sometimes.
Yes.
Both arms, both palms.
Correct. So you have to work on this. Just see what happens. If it is very chronic, we'll have to understand why it is happening in a better way. Then you can probably reach out. Otherwise, if it is very, recent, then it might even go away.
Thank you very much, madam. Very good. Some that names can you write? WhatsApp, can I ask you? Narayana Tail and anything? Other name?
I am just typing it also. Narayana Taila or Kshira Bala Taila. You would say if anybody can use. Rather, I suggest everybody, even you might have a pain, you might not have a pain. You can always apply these oils weekly, twice or thrice on your neck, shoulder, and arm, and on your back as well. Or you want to apply it across the body, apply, because oil application is one very good way to strengthen your muscles.
Warm oil or normal oil directly itself? I have to make it warm oil?
No, that's okay. You can warm or you can apply directly also.
Before bath? That is
before bath. Yes, half an hour before bath.
Half an hour before.
Yes.
Thank you very much. I will try my best whatever possible.
Sure. Okay. Done. Thank you.
Hi, good afternoon, doctor.
Good afternoon.
Thanks a lot for a very informative session, very well curated, and you covered almost all aspects. One quick question: in your do's and don'ts, you had a picture on the sleeping posture, basically,
right,
including sleeping flat on back. Is it advisable to sleep without a pillow, especially from the neck perspective, or on a cotton mattress, or still a thin pillow should be used? Okay.
So usually when you have a chronic neck pain, what is suggested is definitely not use a typical pillow, because especially, many people also have very soft pillows. You just put your head and then your head dips into it. A typical hotel, also when you go and, whatever
Sure.
best 5-star hotel, you will have that kind of a pillow, right? So definitely that is not advised, because those pillows increase your pain, and because of that softness and your neck gets into it, it doesn't help in relaxing the neck. It leads to more stiffness. This is one side of the story. Other side, if you are even prone, what I just suggest is you take a very thin pillow, get some customized pillow for you, just a thin one. It has to be hardly, an inch thin, cotton, but they should not stuff it too tight, not stuff it too loose, very medium, moderately done pillow. As I said, neither too hard, neither too soft, and that works very well. But a typical pillow size, that it will be maybe about 15 inches or so, right? Wide. The same thing, try to place the pillow till here. So when you sleep, your pillow has to rest from here until here. Your shoulder also has to be on that when you have regular pains. Otherwise, if you're prone, you don't have to worry. Just the normal pillow like this, thin one, or just fold a normal handloom bedsheet so you get some thickness out of it. Just place it here. You don't have a handloom bedsheet, a terry towel, like a bath towel. Just fold it. It has to be at least this wide. It can't be a small one. Don't roll the towel and just keep it here when you have pain. Many times that also increases pain. So you can just place it as usual like a pillow, but ensure that at least till here you sleep on it. And that can actually help with neck pain. To tell you frankly, I also used to have maybe in long ago. So we figured out and regularly just use this thin pillow and zero issues. But yes, you have to do neck and back exercises, strengthening, all that is important. Just change of posture may not help you. The other part is also very important.
True. Thank you. Thanks a lot for very practical tips.
Thank you.
Madam, just a continuation of that. The pillow should cover to the up to shoulder. What do you mean?
Yeah, if you have neck pain consistently, then you have to take a pillow, and when you sleep, it should come. The normal pillow will come. Many times what happens, we use the pillow, but our head is in the middle. So you keep the pillow from here, it will cover till here. So sleep like that, so that your shoulder is also given rest. If not, it will dip below the pillow and you will again start feeling the stiffness.
Oh, good, madam. Okay. Thank you.
Okay. So do we
Hi, ma'am. Yeah, hi, this is Soundarya. So I just joined just few minutes back. I missed the timing. So I'm not sure I would have missed many things, but coming to this pillow part, right? So I use the towel with few inches thick, like roll it and keep it under the neck. And still it's not helping me somehow, as you mentioned, like the shoulder part. I have sort of neck pains for past 2 years now, and I'm an IT professional. So posture was an issue, and then I have corrected my posture. Still, like if I am on regular exercises, then it helps. Again, if I am missing my exercise for a month or so, it becomes chronic again, and it goes until the back of the head, like the lower back of my left head. So it's like, the pain is pretty sharp. Is there anything that you can help me for that specific issue that I'm facing? Like it comes until only on the left side of my head and the lower head. That's my whenever it goes chronic, the pain is sharp there. And right now I'm facing that.
Right. See, one is if your pain is chronic, simple remedies, these are all definitely needed as you work on your pain. But some external Ayurveda therapies of fomentation, followed by this, when you look at your lifestyle, you're going to again have long-term results. That is what we observe. But in the present question of yours regarding the towel, I don't suggest to roll the towel. I just mentioned it, when we were discussing on this towel thing, actually. Don't roll the towel because your neck gets extended. Okay, suppose you roll the towel. Just give me a moment. I just show how it looks.
Sure.
See, you're using a towel, you are keeping it like this, okay? Your neck is extending.
Yeah.
You should not do it. Because the moment your neck gets extended, there is a lot of stiffness here. So what I'm therefore suggesting is, if this is a towel and you just have to lie down. Now you look at this as a pillow. This I have put it as a square, but it has to be a rectangle. See how much it comes. It comes almost as I said, below your shoulder, this is what you have to do. Sleep like this, and that will give you a lot of relief.
And this thickness is enough? Is this thickness enough?
This thickness is enough. You take a little larger towel. If you want little thickness, take 2. Now I've just taken 1. Okay. Sometimes the towels are larger. So you can always do this. So if you keep it, okay, like you can see it very clearly. Now you can see how much it comes to. Okay. The same thing if you fold a little more larger, it will come. You can even take complete rectangle like this and keep it and use it also. But take 2 because this is very thin. So it has to be. Yeah, if it's very thin, there's no use. You don't feel the change. So it has to be little thicker, but around an inch, not too much. And this, you also have pillows in the market. Some of them are getting help with those pillows as well, but some of them it doesn't suit at all. But there
can you suggest something which can help actually? I have tried quite a lot, nothing worked for me, and then I have tried this. But again, here also I have an issue, like I put my hand above my head, below my head. So that comes naturally while sleeping. I don't know how to
make it a practice. So many people keep their hand like this, raise their hand like this, and they are not aware, and then they have a heavy shoulder.
Exactly.
Down. You have to slowly start training yourself. So this happens because of long-term memory, which is already stored. So your hand is going to go up, like how children sleep with hands up. This is not going to help, and this is going to worsen your condition. So you have to modify yourself. So either sleep straight, sleep to the side. Side also increases neck pain when you have. Correct. So sleeping straight is always better. And you have to tell yourself that I am not going to do this, or rather tell somebody if you slept earlier, pull your hand down, when you do. So I think you just have to work around. I cannot give you any answer for this question, but you have to train your brain to say that it doesn't go up naturally, because all this is because of the stored memory you have, which will get your hands up. But the towel thing works. And apart from this, apply oil every day. I also shared what oils people can use on the chat. So that
sorry, ma'am, I missed it actually. Can you share it over my email?
You can see the chat. It's open to everyone. I just spoke about 2 oils which you can apply every day, whether you have pain or not, because it will help in neck strengthening. Do these exercises. You can watch this video on YouTube later. Then I have given some exercises as well. And if it's very chronic, doing the Ayurveda therapy will be most beneficial. After that, you continue with exercises, yoga, because they are essential to see that you don't get back the pain.
Sure. Thank you.
Welcome. Okay. So I think if we are done with the questions, we could probably close for today. So any other questions? If you need any help or anything, you can always reach out for a detailed consultation, which I regularly take up. So any other help, you can have a chat. All right, so thanks for joining in. And I do these sessions just to educate people. So you can always join us if you're for the programs, or if you think you need it for any community of people also, you can probably let it. So thank you once again for joining in. Have a great day ahead.
One more question, just madam. Can I call on phone? Is it possible online?
You can reach out to our reception.
Okay.
And then they will help you. Okay. Which is, I have just put the reception number also. You can go on to our website, Vivekananda.com.
Yeah, I checked that. Okay.
Then there also you have all the details of which number to call, etc.
Thank you very much.
Thank you. Okay. Thank you. Thanks for joining, and have a great day.
Thank you. Same to you, madam.
Thank you very much. Bye-bye.